Acid-base balance NCLEX questions and answers. Question 1. The nurse reviews the arterial blood gas results of a client and notes the following: pH 7.45, PaCO2 of 30 mm Hg, 30 mm Hg, and HCO3 of 20 milliequivalent/L, 20 mol/L. The nurse analyzes these results as indicating which condition: metabolic acidosis, compensated; respiratory alkalosis, compensated; metabolic alkalosis, uncompensated; respiratory acidosis, uncompensated. Question 2. The nurse is caring for a client with a nasogastric tube that is attached to low suction. The nurse monitors the client for manifestations of which disorder that the client is at risk for: metabolic acidosis, metabolic alkalosis, respiratory acidosis, respiratory alkalosis. Question 3. A client with a 3-day history of nausea and vomiting presents to the emergency department. The client is hypoventilating and has a respiratory rate of 10 breaths/minute. The electrocardiogram (ECG) monitor displays tachycardia, with a heart rate of 120 beats/minute. Arterial blood gases are drawn and the nurse reviews the results, expecting to note which finding: a decreased pH and an increased PaCO2, an increased pH and a decreased PaCO2, a decreased pH and a decreased HCO3-, an increased pH and an increased HCO3. Question 4. The nurse is caring for a client having respiratory distress related to an anxiety attack. Recent arterial blood gas values are pH equals 7.53, PaO2 equals 72 mm Hg, 72 mm Hg, PaCO2 equals 32 mmHg, 32 mm Hg, and HCO3 equals 28 milliequivalent/L, 28 mol/L. Which conclusion about the client should the nurse make? The client has acidotic blood. The client is probably overreacting. The client is fluid volume overloaded. The client is probably hyperventilating. Question 5. The nurse is caring for a client with diabetic ketoacidosis and documents that the client is experiencing Kussmaul's respirations. Which patterns did the nurse observe? Respirations that are shallow, respirations that are increased in rate, respirations that are abnormally slow, respirations that are abnormally deep. Question 6. A client who is found unresponsive has arterial blood gases drawn and the results indicate the following: pH is 7.12, PaCO2 is 90 mm Hg, 90 mm Hg, and HCO3 is 22 milliequivalent/L, 22 mol/L. The nurse interprets the results as indicating which condition: metabolic acidosis with compensation, respiratory acidosis with compensation, metabolic acidosis without compensation, respiratory acidosis without compensation. Question 7. The nurse notes that a client's arterial blood gas, ABG, results reveal a pH of 7.50 and a PaCO2 of 30 mm Hg, 30 mm Hg. The nurse monitors the client for which clinical manifestations associated with these ABG results: nausea, confusion, bradypnea, tachycardia. Question 8. The nurse reviews the blood gas results of a client with atelectasis. The nurse analyzes the results and determines that the client is experiencing respiratory acidosis. Which result validates the nurse's findings? pH 7.25, PaCO2 50 mm Hg, 50 mm Hg, pH 7.35, PaCO2 40 mm Hg, 40 mm Hg, pH 7.50, PaCO2 52 mm Hg, 52 mm Hg, pH 7.52, PaCO2 28 mm Hg, 28 mm Hg. Question 9. The nurse is caring for a client who is on a mechanical ventilator. Blood gas results indicate a pH of 7.50 and a PaCO2 of 30 mm Hg, 30 mm Hg. The nurse has determined that the client is experiencing respiratory alkalosis. Which laboratory value would most likely be noted in this condition? Sodium level of 145 milliequivalent/L, 145 mol/L. Potassium level of 3.0 milliequivalent/L, 3.0 mol/L. Magnesium level of 1.3 milliequivalent/L, 0.65 mol/L. Phosphorus level of 3.0 mg/dl, 0.97 mol/L. Question 10. The nurse is caring for a client with several broken ribs. The client is most likely to experience what type of acid-base imbalance? Respiratory acidosis from inadequate ventilation. Respiratory alkalosis from anxiety and hyperventilation. Metabolic acidosis from calcium loss due to broken bones. Metabolic alkalosis from taking analgesics containing base products. Question 11. The nurse reviews the arterial blood gas results of an assigned client and notes that the laboratory report indicates a pH of 7.30, PaCO2 of 58 mm Hg, PaO2 of 80 mm Hg, and HCO3 of 27 milliequivalent/L, 27 mol/L. The nurse interprets that the client has which acid-base disturbance? Metabolic acidosis, metabolic alkalosis, respiratory acidosis, respiratory alkalosis. Question 12. A client with a history of lung disease is at risk for developing respiratory acidosis. The nurse should assess the client for which signs and symptoms characteristic of this disorder: bradycardia and hyperactivity, decreased respiratory rate and depth, headache, restlessness, and confusion, bradypnea, dizziness, and paresthesias. Question 13. The nurse is reviewing the arterial blood gas analysis results for a client in the respiratory care unit who is receiving nasal oxygen and notes a pH of 7.38, 7.38, PaCO2 of 38 mm Hg, 38 mm Hg, PaO2 of 86 mm Hg, 86 mm Hg, and HCO3 of 23 milliequivalent/L, 23 mol/L. What action should the nurse take in response to these results? Discontinue the oxygen. Continue monitoring the client. Call 911 to have the client intubated immediately. Have another set drawn because these results are not possible. Question 14. A client's blood gas results reveal acidosis. What are some signs and symptoms the nurse would expect to see? Seizures, lethargy, headache, weakness. Question 15. The nurse is reviewing the arterial blood gas values of a client and notes that the pH is 7.31, 7.31, PaCO2 is 50 mm Hg, 50 mm Hg, and the bicarbonate, HCO3, level is 26 milliequivalent/L, 26 mol/L. The nurse concludes that which acid-base disturbance is present in this client? Metabolic acidosis, metabolic alkalosis, respiratory acidosis, respiratory alkalosis. Question 16. Arterial blood gas analysis yields the following results: pH 7.48, 7.48, PaCO2 32 mm Hg, 32 mm Hg, PaO2 94 mm Hg, 94 mm Hg, HCO3 level 24 milliequivalent/L, 24 mol/L, for a client seen in a healthcare clinic. The nurse interprets that the client has which acid-base disturbance? Metabolic acidosis, metabolic alkalosis, respiratory acidosis, respiratory alkalosis. Question 17. The nurse is caring for a client whose arterial blood gas results reveal alkalosis. What client reactions would the nurse expect to see? Tetany, lethargy, tingling, confusion. Question 18. An anxious preoperative client is at risk for developing respiratory alkalosis. The nurse should assess the client for which signs and symptoms characteristic of this disorder: headache and tachypnea, hyperactivity and dyspnea, muscle twitches and cyanosis, lightheadedness and paresthesias. Question 19. The nurse is performing a change of shift assessment on a client. The client had an arterial blood gas specimen drawn during an admission workup on the previous day and has a hematoma at the puncture site. What is the priority nursing intervention? Perform the Allen's test. Apply a warm compress. Administer the antidote for heparin. Notify the hospital laboratory supervisor. Question 20. A client has a prescription for a set of arterial blood gas, ABG, samples to be drawn on room air. The client currently is receiving oxygen by nasal cannula at a delivery rate of 3 L/min. After reading the prescription, the nurse should take which action? Remove the nasal cannula for 15 minutes, then have the ABG samples drawn. Change the nasal cannula to a shovel face mask, then have the ABG samples drawn. Leave the nasal cannula in place for 15 minutes, then have the ABG samples drawn. Change the nasal cannula to a Venturi face mask, then have the ABG samples drawn. Question 21. The nurse is planning to obtain blood for arterial blood gas analysis from a client with chronic obstructive pulmonary disease. The nurse should plan time for which activity after the arterial blood specimen is drawn. Holding a warm compress over the puncture site for 5 minutes. Encouraging the client to open and close the hand rapidly for 2 minutes. Applying pressure to the puncture site by applying a 2x2 gauze for 5 minutes. Having the client keep the radial pulse puncture site in a dependent position for 5 minutes. Question 22. A client experiencing metabolic acidosis is to be admitted to the nursing unit. The nurse plans care knowing that what reaction is the most powerful regulator of acid-base balance. Buffer, kidney, cations, respiratory. Question 23. The nurse is caring for a client with metabolic alkalosis. The nurse plans care knowing that most problems of metabolic alkalosis are related to increased stimulation of what systems? Buffer, cardiac, nervous, chemical. Question 24. The nurse is caring for a client who is retaining carbon dioxide, CO2, as a result of an obstructive respiratory disease. The nurse plans interventions knowing that as the client's CO2 level rises, what will occur with the blood pH? Fall, rise, double, remain unchanged. Question 25. A client with diabetes mellitus has a blood glucose level of 644 mg/dl, 35.7 mol/L. The nurse plans care knowing that the client is at risk for the development of which type of acid-base imbalance? Metabolic acidosis, metabolic alkalosis, respiratory acidosis, respiratory alkalosis. Question 26. A client is diagnosed with respiratory alkalosis induced by gram-negative sepsis. The nurse should plan to carry out which prescribed measure as the most effective means to treat the problem. Administer prescribed antibiotics. Have the client breathe into a paper bag. Administer antipyretics as needed, on PRN basis. Request a prescription for a partial rebreather oxygen mask. Question 27. The nurse is caring for a client with chronic kidney disease. Arterial blood gas results indicate a pH of 7.30, 7.30, a PaCO2 of 32 mm Hg, 32 mm Hg, and a bicarbonate concentration of 20 milliequivalent/L, 20 mol/L. Which laboratory value should the nurse expect to note? Sodium level of 145 milliequivalent/L, 145 mol/L. Potassium level of 5.2 milliequivalent/L, 5.2 mol/L. Phosphorus level of 3.0 mg/dl, 0.97 mol/L. Magnesium level of 1.3 mg/dl, 0.53 mol/L. Question 28. The client tells the nurse that he ingests large amounts of oral antacids on a daily basis. The nurse plans care knowing that the excessive use of oral antacids containing bicarbonate can result in which acid-base disturbance? Metabolic acidosis, metabolic alkalosis, respiratory acidosis, respiratory alkalosis. Question 29. The nurse reviews the arterial blood gas results of an assigned client and notes that the laboratory report indicates a pH of 7.30, 7.30, a PaCO2 of 58 mm Hg, 58 mm Hg, a PaO2 of 80 mm Hg, 80 mm Hg, and an HCO3 of 26 milliequivalent/L, 26 mol/L. The nurse should interpret this to mean that the client has which acid-base disturbance: metabolic acidosis, metabolic alkalosis, respiratory acidosis, respiratory alkalosis. Question 30. The client with a history of lung disease is at risk for developing respiratory acidosis. The nurse asks this client about which symptoms that are characteristic of this disorder. Do you have shallow breathing? Do you feel like you have a lot of energy? Do you have a headache or become confused? Do you feel dizzy or have tingling sensations? Question 31. The nurse is caring for a client with respiratory failure related to Guillain-Barré syndrome. The nurse plans care knowing that what other extrapulmonary causes can lead to respiratory failure: stroke, pneumonia, sleep apnea, myasthenia gravis. Question 32. A client is admitted to the hospital 24 hours following an aspirin, acetylsalicylic acid, overdose. The nurse assesses this client for which signs/symptoms indicating the acid-base disturbance that could occur in the client: bradypnea, dizziness, and paresthesias, headache, nausea, vomiting, and diarrhea, bradycardia, listlessness, and hyperactivity, restlessness, confusion, and a positive Trousseau's sign. Question 33. The nurse reviews a client's arterial blood gas values and notes a pH of 7.50, 7.50, a PaCO2 of 30 mm Hg, 30 mm Hg, and an HCO3 of 25 milliequivalent/L, 25 mol/L. The nurse should interpret these values as an indication of which condition: metabolic acidosis, uncompensated; respiratory acidosis, uncompensated; respiratory alkalosis, uncompensated; metabolic acidosis, partially compensated. Question 34. The nurse is preparing to obtain an arterial blood gas specimen from a client and plans to perform the Allen test on the client. The nurse would perform the steps in which order to conduct an Allen test. Explain the procedure to the client. 2. Apply pressure over the ulnar and radial arteries. 3. Ask the client to open and close the hand repeatedly. 4. Release pressure from the ulnar artery. 5. Assess the color of the extremity distal to the pressure point. 6. Document the findings. Question 35. A client is about to have arterial blood gases drawn, and the nurse explains what an Allen's test is. What comment shows that the client understands the nurse's explanation? Blood is drawn from the ulnar artery. I know I have to lie down while blood is drawn. This test is done to ensure adequate collateral circulation. Direct pressure has to be placed over the site for 15 minutes after blood is drawn. Question 36. The nurse is caring for a client with diabetic ketoacidosis whose respirations are abnormally deep, regular, and increased in rate. What is the purpose of this type of respiration? Correct bradypnea. Blow off carbon dioxide. Correct metabolic acidosis. Correct an acid-base imbalance. Question 37. The nurse reviews a client's arterial blood gas results and notes that the pH is 7.30, 7.30, the PaCO2 is 52 mm Hg, 50 mm Hg, and the HCO3 is 22 milliequivalent/L, 22 mol/L. The nurse interprets these results as indicating which condition: metabolic acidosis, compensated; respiratory alkalosis, compensated; metabolic alkalosis, uncompensated; respiratory acidosis, uncompensated. Question 38. A client with diabetes mellitus is most likely to experience which type of acid-base imbalance as a complication of the disorder? Metabolic acidosis, metabolic alkalosis, respiratory acidosis, respiratory alkalosis. Question 39. The nurse is admitting to the hospital a client with a diagnosis of Guillain-Barré syndrome. The nurse knows that if the disease is severe enough, the client will be at risk for which acid-base imbalance: metabolic acidosis, metabolic alkalosis, respiratory acidosis, respiratory alkalosis. Question 40. A client is determined by blood gas analysis to be in respiratory alkalosis. Which electrolyte disorder should the nurse monitor for that could accompany the acid-base imbalance? Hypokalemia, hypercalcemia, hypochloremia, hypernatremia. Question 41. A client with a chronic airflow limitation is experiencing respiratory acidosis as a complication. The nurse who is trying to enhance the client's respiratory status should avoid which action? Keeping the head of the bed elevated, monitoring the flow rate of supplemental oxygen, assisting the client to turn, cough, and breathe deeply, encouraging the client to breathe slowly and shallowly. Question 42. An anxious client is experiencing respiratory alkalosis from hyperventilation caused by anxiety. The nurse should take which action to help the client experiencing this acid-base disorder? Put the client in a supine position, provide emotional support and reassurance, withhold all sedative or anti-anxiety medications, tell the client to breathe very deeply but more slowly. Question 43. A client is being treated for metabolic acidosis with medication therapy and other measures. The nurse should plan to monitor the results of which electrolyte, which could dramatically decline with effective treatment of the acidosis: sodium, potassium, magnesium, phosphorus. Question 44. The nurse is caring for a client who is experiencing metabolic alkalosis. Knowing the risks of this imbalance, the nurse plans to protect the client's safety by carefully implementing which prescribed precaution: contact isolation, seizure precautions, bleeding precautions, neutropenic precautions. Question 45. The nurse is caring for a client who overdosed on acetylsalicylic acid, aspirin, 24 hours ago. The nurse should expect to note which findings associated with an anticipated acid-base disturbance: disorientation and dyspnea, drowsiness, headache, and tachypnea, dizziness, and paresthesias, decreased respiratory rate and depth, cardiac irregularities. Question 46. A client has been diagnosed with metabolic alkalosis as a result of excessive antacid use. The nurse monitoring this client should expect to note which signs/symptoms: disorientation and dyspnea, decreased respiratory rate and depth, drowsiness, headache, and tachypnea, dizziness, and paresthesias. Question 47. The nurse is providing care to a client with the following arterial blood gas results: pH of 7.50, 7.50, PaO2 of 90 mm Hg, 90 mm Hg, PaCO2 of 40 mm Hg, 40 mm Hg, and bicarbonate of 35 milliequivalent/L, 35 mol/L. When the nurse notifies the healthcare provider about these levels, the nurse should anticipate receiving from the HCP which prescription for this client. Obtain a serum alcohol level. Obtain a serum salicylate level. Discontinue nasogastric suctioning. Discontinue the client's fentanyl patch. Question 48. The nurse is caring for a client with hyperglycemia and diabetic ketoacidosis, DKA, who now has developed Kussmaul respirations. The nurse knows that the purpose of this type of breathing is to correct what imbalance: metabolic acidosis, metabolic alkalosis, respiratory acidosis, respiratory alkalosis.